Hey there, fellow foodies. This is Dr. Quave, and you're listening to Foodie Pharmacology, the science podcast for the food curious. Today on the show, I have my wonderful colleague and friend, Dr. Sharon Bergquist. She is a nationally recognized lifestyle medicine pioneer. She's a practicing internist with over 2 decades of patient centered clinical experience. And she's also a scientist whose work focuses on developing early predictors of disease and healthy aging. That's something I can get behind. I think we all want to age a little bit healthier. She's also an advocate for advancing healthcare through integrating lifestyle medicine, resiliency, and prevention based science into clinical care. As far as her title goes, she is the Pam R. Rollins Professor of Medicine at Emory University School of Medicine here in Atlanta, and she's also the founder and director of the Emory Lifestyle Medicine and Wellness. Sharon earned her Bachelor of Science from Yale and her medical degree from Harvard. She completed her internship and residency at Harvard's Brigham and Women's Hospital. She's the host of the Whole Health Cure podcast and co author of this fabulous new cookbook called Plantology, a cookbook based on the science of plant based eating. And I've been looking through this, and there are lots of amazing recipes I'm sure we're going to dive into during the episode. So great to see you, Sharon. Thanks so much for coming on the show.
Oh, thank you so much for having me. I'm excited to be here.
Yeah. So, why don't we start by telling us a little bit about the book that just came out?
Yeah, so the book has been a long time coming. It was really inspired by a lot of the clinical work that I and my co-author, who's a dietitian at Emory, we work alongside each other, created. We found ourselves talking to our patients a lot about plant-based eating, the benefits for health and longevity. And over time, we just put together everything we are telling our patients and some of our favorite recipes in a format that we could share it and hopefully have other people benefit from all the tremendous ways that plant-based eating can make you feel better, feel healthier. So we are excited to share that.
That's great. Well, as a practicing physician and someone who treats, I'm guessing, a lot of people with kind of chronic disease that's associated with SAD, the American diet, the standard American diet, which I think SAD is just the right term for it. It's a sad diet in so many ways. How how do you use food to help empower your patients to get onto the right path for wellness and resiliency?
Yeah. And I think, the first step is really just appreciating the role that food plays in health. I think that we talk about food as well as lifestyle, but how to incorporate that into our well-being and into our everyday habits is something that we all struggle with. We know the power of lifestyle. We know 80% of chronic disease can be preventable with really pretty simple measures, right? Just eat a healthy diet, get physical activity, avoid tobacco and excess alcohol, maintain your body weight. Yet, less than 10% of Americans, and that's a generous estimate, are actually able to do all four. So, a large part of what we help our patients do is just move the needle. Like, nobody has a perfect lifestyle. I don't. I would be a complete hypocrite if I pretended I did everything
Mhm.
right all the time. But the goal is just to do a little bit better, and there's just so much room for just shifting a little what's on our plate, a little bit more activity, that if we can just all do that and make little incremental changes, this works in a dose benefit kind of response. So, a lot of medicines, the higher the dose, the greater the benefit. And eating plant based food and exercise for that matter work very similarly. So, the idea is let's just increase the dose of the good stuff.
I like that, increasing the dose of the good stuff. That's great. Well, maybe we could touch on how diet plays into the different elements of health. So we have physical health, we have mental health. Um, does diet also affect our mental health and how we feel?
Yeah, I'm so glad you asked that because when people think of diet in health. They think, okay, if I forego all these things I love, maybe 20, 30 years from now, there may be less heart disease, or I may live a few years longer. And they think of it as a give a lot today, benefit a lot many, many, many years from now.
Mhm.
And really, that's just not motivating for a lot of
Yeah.
people. But the symptoms, the day-to-day effect that diet has on health is really what I think is underemphasized. So, absolutely, food plays a role in mental health, and not just mental disorders like anxiety, depression, ADHD, but in your mood, in your creativity, right? You don't have to be warding off mental illness. There have been studies that show within the same week, on a day to day basis, there's a correlation between plant based eating versus processed foods, and anything from how meaningful you pursue your thoughts and processes that day, to your creativity, your critical thinking. So it's the day to day, your energy, the mood, that I think gets you kind of hooked. Like, you just have to have this belief that it's going to make a difference. Try it. And once you do, you can't go back because you feel so much different and so much more energized.
No, I 100% agree. I've definitely been on periods where, again, not a perfect follower of a good diet. I really try to. But there are days where, yeah, especially when I'm traveling, I have a lot of fast food and, man, or processed food, and I do feel sluggish and tired and just drained. And getting back on fresh vegetables, a nice salad, fruit, it does make me immediately feel better, at least. I don't know if that's placebo or but I don't know.
Yeah.
I feel the physical effects, it seems like. Yeah.
Yes, definitely real. If it were placebo, I would be figuring out how to make a donut have the same effect.
Right? That's great. Well, why don't you tell me or share with us a little bit about how do you counsel patients to start to make these changes? Because I think it's one thing to say, okay, go forth and eat a plant-based diet. But it sounds simple, but I know from experience it's not always an easy thing to do. A lot of people perhaps don't have the cooking skills or even know where to start in terms of recipes, especially if you're used to eating a lot of kind of prepackaged or frozen foods. So, how do you get folks to start on the path, or what seems to have worked so far?
Yeah. So I'll start off by saying there's a lot of misconception around what we're trying to accomplish when we're eating plant based. So I'll start off with saying what plant based is not. So
Mhm.
plant based does not mean you have to entirely eliminate any food group. Right. Even a diet that includes meat and poultry can be plant based. The emphasis really that I encourage for my patients is to have more plants as the star of your dietary pattern. So it's focused more on what you're trying to include than what you're trying to remove or restrict.
Mm.
Okay, so with the goal being that we're trying to add more plant-based food, and by plant-based food, I mean not just fruits and vegetables, but whole grains, nuts and seeds, legumes, spices, anything that is essentially plant origin. Um, and a simple place to start is, let's look at what's on our plate now. So if you look at the American plate, and this is data from um, a lot of studies that capture this from like just national databases. Our plate right now has about 60% processed food, and the amount that's coming from fruits and vegetables is around 8%. So the simplest place to start is just add more fruits and vegetables. Um, and it could be not, necessarily taking the place of anything, but just start thinking about, how can I just get one more serving of any fresh fruit or vegetable? I think that's one really simple place to start. And another thing I really encourage my patients to do is think about, what is a portion size? So when we get a typical entree at a restaurant here in the United States, the focus of the entree is on, say, the protein, if you will. Like typically it's, you order a chicken dish, it's a big piece of chicken and then a little side salad. And a serving of chicken is a deck of cards. I mean, it's like 3 ounces. So typically, what you're getting served is many servings of the chicken. And what you're getting underserved is the amount of vegetables that you need. Your goal is to have half your plate be vegetables. And so, another way that I think is pretty easy to start making a shift is just change the proportion. So, have more of the fruits or vegetables and just a little less of the meat. So, just flip your plate. So, salad with a garnish of chicken instead of chicken with a side salad.
I really like that. Flip your plate. That's it. That's great. And I think that's a much more approachable way to think about a healthier diet because you know becoming fully vegan or fully vegetarian can be an intimidating process. But I like this idea of kind of flipping the starring roles of the different characters that do show up on your plate. Um, I want to talk a little bit about diabetes also, because this, I think, ties into this concept of flipping the plate. There was a recent study that was released and also covered on the global media about how refined carbohydrates, global consumption of refined carbohydrates, and a lot of red meats, it seems to be tied to driving up higher and higher rates of type 2 diabetes. Um, for Is there a reason that folks should be worried or concerned about type 2 diabetes? What are the risk factors and kind of when do you know this is time to really make a change? Because, I'm wondering how many of us are out there that could be pre-diabetic on these diets. I'm just looking for, I don't know how to say this, but what's going to be the alarm bell? We want to get the alarm before it gets to the stage of actually developing type 2 diabetes.
Right. So I think this is such a great question because there's not a single week in clinic where I don't have at least a dozen people, quote, newly diagnosed with usually pre-diabetes before diabetes.
Hmm.
And the type of diabetes I should start by clarifying is type 2 diabetes, which is about 95% of diabetes. Type 1 has a different etiology, and it's about 5% of people. But type 2 is by and large driven by insulin resistance. And the foods that you mentioned, the processed carbohydrates and these saturated fats that are abundant in our S.A.D diet, those are the foods that are the underlying drivers of insulin resistance. When we find a blood sugar that is in pre-diabetic range, the process of insulin resistance has already been taking place for years. So even though I put, new diagnosis in quotes, the reason is this is not really a new diagnosis. This is the end stage of your pancreas no longer being able to compensate for insulin resistance. So when insulin resistance occurs, your pancreas, which is the organ that makes insulin, for years compensates by just making more insulin. But there's only so long your pancreas can work in overdrive. And when it starts to peter out, then there's no longer the compensation for blood sugar being elevated, and you start to see a pre diabetic range blood sugar. So I would encourage people to not wait until they get told they have prediabetes to start to make changes at far earlier stages. And, for people who actually want to get insulin levels tested and measure insulin resistance, that is something that labs are capable of doing. But I think, you know, again, if you're following a plant based diet, you're not only going to prevent that, but you are also going to prevent all the other diseases that typically travel with diabetes because the underlying cause is very similar of multiple chronic diseases.
Yeah, that's such a good point. there's a course that we teach in our undergraduate program in human health, and it's called Many Diseases, Few Causes. And it's based on this idea of, a lot of our chronic or lifestyle diseases that are attributed to diet, but also other environmental exposures. Yeah, there are very few causes. It has to do with inflammation, oxidative stress, immune dysfunction. We're seeing also, unfortunate rises in immune dysfunction, especially as you age. I mean, it you get to higher and higher risk. So I think that it's important that people recognize that your diet is actually really important. I think it's just really underestimated how important the diet is to your health, and not just now, but well into the future. Yeah.
Yeah, and that's been studied just so well. I mean, the role of diet in health. I'll tell you the probably the largest one of the largest studies we have to date is the Global Burden of Disease study, which looked at diet in 195 countries over a span of 27 years. And in that study, they found that diet is the biggest risk factor for the chronic diseases that we're talking about, more than physical inactivity, more than tobacco, more than excess alcohol. So we're talking that the number one cause that we are getting epidemic rates of these chronic diseases is actually in our control. It is entirely modifiable.
Well, I think the idea of control is an interesting point. And I'll bring this up because, at least in our household, I've gotten to the point where I really try to avoid the grocery store, our classic supermarket, as much as possible, because anything in the inner aisles of the grocery store is laden with refined carbohydrates, corn syrup, unhealthy saturated fats. Um, and so there's really nothing in the middle aisles that I can safely eat if I'm going to really try and make a change. And so we're trying this right now in our house, just to go to it's a larger kind of ethnic market that has primarily just fresh produce and meats and vegetables and cheese and things like that. And it makes shopping a bit easier because I'm not as anxious about getting down getting down those aisles. Um, but I think that's also something that, yes, we have choice, but not everyone has access to affordable fresh produce. Um, and this has to do a lot with, the um, economic situation in which our farm bill in the US places us in, because we heavily subsidize corns and refined carbohydrates that basically drive this epidemic of diabetes and other chronic disease. But we don't have similar types of subsidies for healthy food. So I was wondering if you could talk a little bit about that, because it's almost like we're, at least in my feeling, that I have to go counterculture to be healthy in America. Um, I wonder what your perspective is there.
Yeah, I mean, it's certainly something you have to do with effort. I think the default is no question to have, what we're calling our standard American diet, which is not healthful. I think there are a couple things. So, first of all, I think it's great that you don't go to these middle aisles. And for anyone who does walk into a grocery store, just shopping the perimeter is a really nice way to try and accomplish the same if there isn't a local farmer's market or anywhere else that you can get fresh produce. In terms of making plant-based diets work for you, make them affordable, um, first of all, the foods have to be delicious. They have to fit your preferences, your customs. So you have a lot of leeway and flexibility. Okay. So there's not one diet that is the only path to health. In fact, if you look at some of the healthiest dietary patterns, be it paleo, Mediterranean, the common theme is whole food, like you just said, avoid the processed, and mostly plant based. If you walk into a grocery store and you're looking to make it affordable, I think some of the ways to do that are to pick the components of a plant based diet that are extremely inexpensive. Beans, lentils, for example, you can get a bag of beans that you can boil, and make a meal with, say, a whole grain that you can also buy in a bag that's fairly affordable. Whole grains being farro, quinoa. When you buy them in their state unprepared, they're incredibly inexpensive. I mean, for under $1, you can make a meal with grains and with, just a good healthy protein, be it lentils, any kind of legume. And then to add the fruit or vegetable, either look what's in season. There's usually some special on what fruit and vegetable that, grocery store or farmer's market may be kind of having as their focal weekly item, or go to the frozen section. So, frozen fruits and vegetables have very similar nutrient content to fresh. So, don't feel locked in that you have to get fresh. When a food is frozen, it's usually flash frozen at the peak of ripeness. Sometimes you actually get better tasting fruit when it's frozen because of that. And when you buy fruit that is fresh, oftentimes there's a lot of nutrients that are lost in the transport process. So, from the time that fruit is taken off the vine, it no longer has a nutrient source. It has to use itself for energy. So the nutrient content of that fruit is decreasing the more days it is separated from the actual root that it was giving it its nourishment. So there's some loss of nutrients, whether you're getting fresh or frozen. And at the end of the day, they're fairly comparable. So go to the frozen section, get a bulk bag. And oftentimes things are cheaper if you get a big giant bag of broccoli frozen. And you always have something in your home, in your freezer, in your pantry. If you get bags of beans, bags of grains, and fruits and vegetables in your freezer, and that can be your go-to if you don't get a chance to go to a local market or you have to drive far away to have access to one.
That's such great advice. And I definitely I agree on the frozen stuff and the beans. That's yes. I think that's another misconception many people have is that to eat a plant-forward diet or plant-based diet that it's going to be very, very expensive and require a garden and land to do that. And it doesn't. You're absolutely right. And I always keep frozen spinach and frozen berries in the freezer because it's just easy in a pinch. And I'm a huge fan of Instapots. I don't know for pressure cooking because I think one of the other challenges that at least we face, and I'm sure many others, is that I don't always have a lot of time to spend in the kitchen. So I love any kind of recipe that can get started in the Instant Pot, turn it on, and walk away. And lentils and all these whole grains. These are all great in the Instant Pot for sure. Very easy to make.
I'm a big fan of Instapots and kind of in the same boat. We both work full time and we've got kids and
Mhm.
we've got a lot of after hours work related tasks. So finding time is always a challenge, and getting a healthy meal on the table every night is quite hard. I mean, there's a lot of planning and effort that can go into meal preparation. But we always have, frozen fruit smoothies are a huge item in our kitchen. And with, there's some shortcuts you can take that are okay as well. There are now a lot of whole grains that are cooked that are microwavable. I mean, these bags are fairly healthy, and it is okay to take these shortcuts if you need to. Um, Canned are another way to get beans if you don't have time to cook the beans, which does take time. You can, some of them have salt, so getting salt free or low salt or rinsing them out to reduce the salt would be helpful. But you can take these shortcuts, or if you're going to cook grains, batch cook them, like cook an extra amount and then freeze the extra for later, or put it in your refrigerator and use it in multiple meals like school cafeterias did when we were in elementary school. And the same ingredients show
Yeah.
up in
It's
different
like, "Hey, I
meals.
recognize that. Wasn't that from Tuesday?" It's like
Yeah,
yeah,
yeah.
yeah. Yeah, I like that idea. Yeah, batch cooking. There's lots of great books out there also on batch cooking, how to kind of prep different meals using some, for the week so you can plan out and have a healthy meal. Um, I think you're absolutely right. We can save money and have a healthier diet in those ways. Well, as we get closer to wrapping up, I do want to take a look into the book and maybe you can tell us a little bit about its structure. Now, I know some of this was also inspired by work that you did, with an education program at Emory. Do you wanna tell us a little bit about that?
Yeah, one of, my passions is trying to incorporate healthier eating in the healthcare space. So creating programs has been one of the ways we've tried to do that because to get people to make a change, I mean, we all struggle with this. It has to be comprehensive, right? There's mental health components. I mean, there's a lot of stress eating that people do. I think there's a lot of synergy between eating well and physical activity. So we tried to create more comprehensive programs because you can't just tell someone eat healthy when you're not looking at the larger context of their life and trying to get to, well, what are the reasons? What are the obstacles? So that's been the impetus behind the programs we've created. And when we wanted to structure healthy eating for people, which we did in the cookbook, probably the biggest premise is helping people define what's healthy.
Mm,
We use the term all the time. And most of my patients, if I ask them, do you think you eat a healthy diet? Most say, well, of course, yeah, I eat healthy most of the time. If you look at studies on how well people do when they rate how healthy their diet is, well, we don't do as well. So, a study that came out last year asked 9,700 people whether, how they rate their diet excellent, very good, on down to poor. And they gave people 24-hour food frequency questionnaires. These are questionnaires that actually objectively measure the different food components. And when they compared the two, 85% of people overestimated how healthy their diet was. Okay, so almost 9 out of 10 people who think their diet is healthy, it's not as healthy as you think it is.
well, I feel
So
like
then,
we're tricked though too in some ways because so many products are marketed as healthy. Look at, kefir or yogurts with, that have fruit flavoring. They're loaded with sugar, loaded. So it's like on one hand I say, well, I'm eating something healthy, but am I? It's yeah.
oh, you're absolutely right. I mean, I think probably the best defense we have against this marketing is whole food. And
Mhm.
that's the premise behind the cookbook, right? Because
Yeah.
once food is processed, it's so hard to know what are these ingredients. And then you have to read every label and decipher, what's the nutritional content. You don't have to do that with whole food.
Mhm.
And to structure how much of each whole food, there are a lot of categories, as we mentioned: fruits, vegetables, whole grains, nuts and seeds, legumes. We created a checklist. How many servings of each do you need to have every day, or at least aim to have every day? What is the serving size of each? And then we divided the cookbook by category. So if you need to get 3
Breakfast.
checks
Mhm.
in the vegetable category, well, here's some recipes based on vegetables. And you can, organize it that way. The interesting thing is when you think about food as, am I getting enough of the good stuff? Am I getting my check boxes? You break out of the mold of needing to think about food as what's a breakfast food, what's a lunch food, what's a dinner food. You can have a smoothie for dinner. You can have, a big grain bowl for breakfast. It doesn't matter. The focus is really get delicious food that supports your health and longevity and makes you feel better. So that's really how we structured it. Most cookbooks are, here are breakfast, items, here are desserts, and
Yeah.
we're much more interested in having people just get enough of the good stuff.
Well, I can jump on board for that. I'm I'm having a pseudo healthy lunch right now. I've got some cheese and apple and strawberries. So I went kind of on the sweeter side for So I need to get more vegetables and beans and grains next time. But yeah,
Sounds like you got at least 2 checks on that
I
lunch.
got 2 checks. I like it. I like it. 2 checks. I'll take it. Well, Sharon, I always like to ask our guests, is there one simple recipe you could share with us just for the listeners, to give them a little teaser for the book? Like what's a fun favorite recipe that you have in the book?
Yeah. One that's always a hit in our household, and I'll say that I have 3 children, so this is, kid tested,
Yes.
is, making chocolate chip cookie dough with using whole grains and using beans.
Mm,
So that we have a recipe in there for a chocolate chip cookie dough that is entirely based on using whole grains, um, fresh applesauce. It has beans, chickpeas in particular, and it is amazing to me how it tastes so similar, and you've taken, you've instead of a refined, processed, flour, you're now using a whole grain. You have no sugars that are usually put into chocolate chip cookies. You've converted the fat into healthy fats. So I love recipes like that that take what we all love, these classics, and then they substitute really healthy ingredients. And it's remarkable how little you notice a difference in taste and how much benefit you gain from a health standpoint.
that's amazing. Oh, that sounds super tasty too. That's great. Well, where can folks find your book at, Sharon? I know it just came out recently this spring. So, in bookstores and on your website.
Um, Yep. Well, you can do several things from the website. There's a link to ordering it. Amazon's probably the easiest place. We can you can find it there in hardback, paper cover, as well as the ebook version off of Amazon. On my website, if you put in your confirmation, you can get a free download guide that helps with meal planning and how to get started on a plant based diet. So I would encourage people who get the book to get the free download because it's a really nice, just quick starter, organizes your week to try and make the process easier.
That's great. I mean, it's always helpful to have a starting, kickoff point for meal planning. And folks, you can find that at it's at drsharonbergquist.com is the website for those that are tuning in today. Well, thank you so much, Sharon. This has been fun. I've learned more. I'm about to see, what other check marks I can take off today. And I like this idea of mixing up the meals because I just tend to skip breakfast sometimes because I don't like the very sugary cereals and things, and so maybe I can find some other healthier options from the book.